Dr. O'Connor, we occasionally have to get our blood drawn, and when we do, we get these results, and there's 2 or 3 pages of this and that and ranges, and I'm sure that as we age, certain parts of that report are more important than other parts. Can you shed some light on this?
Yes, so if I'm seeing a patient that's above the age of 35, the most important thing is at least getting their yearly test done. So a metabolic panel will look at the health of their liver and pancreas. So I get a blood sugar reading, I get an insulin reading to make sure they're not falling into pre-diabetes, because we all kind of deal with insulin resistance and trouble metabolizing glucose as we get older. So that's really important to be monitoring is blood sugar. That's from a metabolic panel. Then the next one is called a CBC, or a complete blood count. That one, if I start seeing an elevation, for example, in lymphocytes, and if it's very, very elevated, I have to start worrying about chronic viruses, exposure to hepatitis, leukemias, cancers. So it can be like a first indicator that something's very wrong.
Is there a way that you can look at, even if it's in the normal range, in the following year and the following year, if there's a trend of the count going up or down, but in the normal range, is that a reason to be concerned?
So so when you have everything in the quota, so that's another question in itself, the normal range. So the labs have this range, and it's really a range of serious disease. In preventative medicine, we're not necessarily looking at the range the lab gave us, because we know, for example, with testing thyroid, the lab will say 0.4 to 4.0 is normal. Well, we know anything above 2.0 is not normal, and that's actually thyroid slowing down, which accelerates aging, dry skin, hair loss, low libido, low energy, and feeling cold all the time, and all these other symptoms, digestive problems. So it's really preventatively, you're looking at a much smaller scale, and if that number changes, then there's some natural things we can do to treat it before going on medicine. But if it kind of gets, a pattern of getting really off the chart, then we can offer medication options as well. But another thing, lipid panel. So not just a standard lipid panel, but there is a test called an apolipoprotein A and an apolipoprotein B, and that really gives us an indication. Is that person really at risk for atherosclerosis? Do they have it? Are they more at risk for a heart attack? Another test is called a cardiac specific CRP, and that'll give us a score to know the risk of that patient having a heart attack. Another marker of inflammation as we get older is called homocysteine. And if that number's elevated, then we're worried about elevating blood sugar, and again, risk of heart attack. So even though those aren't classically on your yearly exams, my patients over 35, I tend to do that just to make sure, there's not a inflammatory problem that might not show up on your regular lab work.
Mm-hmm. So you're basically looking at the key internal organs, the heart, the liver, the kidney, and...
Yeah, it's really, the trend right now is inflammation. What leads to inflammation? Stress, working too hard, not getting enough sleep, eating bad foods, all leads to inflammation. And what that does is it inhibits the circulation to the brain. It forms plaques along the artery walls. It increases blood sugar. And when you're stressed out and you're not getting enough rest and happiness and joy in your life, you're just going to be putting out cortisol. Well, when that happens, you're going to store more weight, your blood sugar is going to go up, and you have more chances of building up plaques along the arteries, and then that leads to problems like, chest pain, poor concentration, brain fog.
I'm sorry, what? No.
Right. Yeah. So looking at inflammation is really important. I think that's kind of where medicine is going, hopefully preventatively. So one is inflammation. And yeah.
Is there something I should be considering just because of my age, even though I'm all in the normal ranges?
So genetics have a huge part to play in that. So I always look at what were your parents' health, what were your grandparents' health, because I'll have patients that drink and smoke into their 90s because they have such strong genetics. So I always kind of look at family history as that. But okay, so if you're in your 50s now, the one thing I tell everyone on their 50s, be taking an omega-3 fatty acid. So those are your fish oils, your flax oil, krill oil. Omega-3s actually protect it's called a phospholipid bilayer that protects every cell in the brain. That's so nutrients can easily get in and out. So things like trans fat, which they're starting to make illegal here, that actually stiffened the brain cells, and nutrients can't get in and toxins can't get out. So we thought that maybe was one cause for dementia and other neurological problems. So omega-3 is very protective to the brain and the arteries as we get older. That's a big one.
And what amount of salmon or other fish would we have to eat on a regular basis to avoid having to get supplements?
Yeah, so I always worry about salmon because of all the pollution now in our oceans and the explosion in Japan and nuclear. So when I talk about fish oils, I'm talking about the kind in the gel cap. And I like, there's some really great brands out there that filter out PCBs and toxins out of fish oils. And I'll just mention one brand because I have no allegiance to this company, but it's Nordic Naturals. They have a really pure fish oil. And you need to take 3,000 milligrams a day. So usually one little capsule is 1,000. You take one with each meal.
Gotcha. Awesome. Thank you very much for your time.